Hello everyone, my name is Karen Moore. Today we're going to talk about type 2 diabetes. This is a common condition and understanding it is important for our community's health. My goal is to give you clear, helpful information about what it is, how it affects us, and what we can do about it. In this short presentation, we'll cover the basics of type 2 diabetes. We'll start by defining it, then discuss the signs and symptoms to watch out for. We'll look at who is at risk, how the disease affects the body, and how it's diagnosed. Most importantly, we'll talk about what we can do to prevent and manage it. Type 2 diabetes is all about how our bodies use sugar or glucose for energy. Our bodies need a hormone called insulin to help glucose get from our blood into our cells. Think of insulin like a key that unlocks the cell doors to let sugar in. In type 2 diabetes, either the body doesn't make enough insulin or the cells don't respond to it properly. The key doesn't work as well. This is called insulin resistance. This causes sugar to build up in the blood. Type 2 diabetes doesn't happen overnight. It usually develops in stages. First, there's prediabetes. This is a warning sign. Blood sugar is elevated, but not high enough to be called diabetes. This is a crucial time because lifestyle changes can often prevent progression to full-blown diabetes. If prediabetes isn't addressed, it can develop into type 2 diabetes, where blood sugar levels are consistently too high. Over time, if the disease isn't managed, it can lead to serious complications, which we'll discuss later. Of diabetes can be subtle, especially at first. They often develop gradually. Some common signs include feeling very thirsty, needing to urinate more often than usual, especially at night, feeling unusually hungry, losing weight without trying, feeling tired all the time, having blurred vision, noticing that cuts or sores take a long time to heal, and getting frequent infections. If you experience any of these, it is important to talk to your doctor. Consistently high blood sugar levels can damage the body in many ways. It primarily affects blood vessels and nerves. This damage can lead to serious complications, including heart disease, kidney disease, vision problems, even blindness. Nerve damage, which can cause pain, numbness, tingling, and foot problems that can, in severe cases, lead to amputation. This is why managing blood sugar is crucial. There are several risk factors for type 2 diabetes. The good news is that many of these are modifiable, meaning that we can do something about them. These include being overweight or obese, especially carrying extra weight around the abdomen, not getting enough physical activities, eating an unhealthy diet, having high blood pressure or high cholesterol, and smoking. Addressing these factors can significantly reduce your risk. There are also some risk factors that we can change. These include having a family history of diabetes, getting older, the risk increase after age 45, and your race or your ethnicity. Certain groups such as African Americans, Hispanic Americans, American Indians, Asian Americans, Pacific Islanders have a higher risk. Having had gestational diabetes, diabetes during pregnancy, or having polycystic ovary syndrome, PCOS, also increase the risk. Knowing these non-modifiable risk factors is important for awareness and early screening. Type 2 diabetes disproportionately affects certain racial and ethnic groups in the United States. The CDC report shows that American Indians and Alaskan Natives have the highest preference, followed by non-Hispanic, Blacks, and Hispanics. Asian Americans also show a higher preference compared to non-Hispanic whites. 2 diabetes is diagnosed through blood tests. The most common tests are the fasting plasma glucose test, which measures your blood sugar after you haven't eaten for at least 8 hours. The A1C test, which gives an average blood sugar level over the past 2 to 3 months, and the oral glucose tolerance test, which measures your blood sugar before and after you drink a sugary liquid. These tests help doctors determine if your blood sugar levels are consistently too high. The most important message is that type 2 diabetes can often be prevented or delayed, and it can be managed. The key is making healthy lifestyle choices. This includes eating a healthy diet, getting regular exercise, maintaining a healthy weight, and if necessary, taking medications prescribed by your doctor. Regular checkups are also vital to monitor your blood sugar and catch any potential problems early. In conclusion, type 2 diabetes is a significant health issue, but it's one that we can address. By understanding the risk factors, making healthy choices, and working with your doctor, you can significantly reduce your risk or manage the condition effectively. Early detections and proactive management are key to living a long and healthy life. Sources I used for this presentation. Thank you for your time. Enjoy your day.